2007, the doctors of Ugu District, they did a review of children's illnesses in our institution, in our 4 hospitals. And then they discovered that 80% of those babies were infected with HIV. And then 50% of those babies were dying of HIV-infected related illnesses. Because we knew that these deaths and illnesses were preventable through the PMTCT program. So we needed to strengthen the systems through the PMTCT program. The aim of the program, this PMT, is to reduce the transmission rate. When we started, before we started the project, you know, as my baseline, we had a transmission rate of 21%, meaning that out of every 100 babies, 21 babies were getting infected. But after the intervention that we did, we came down to 6.8% in 2008 towards the end of the year. So that is why we thought that really the project has had an impact on the beneficiaries. What I'm doing is to do extensive monitoring and evaluation, checking whether all the mothers that were there were pre-test cancelled and were tested, and also check whether the CD4 count tests were done to those mothers that are positive, and also to check also whether the dual therapy, the mother did get it dual therapy, and those that need antiretroviral therapy got that.
I am so happy about this now, because even the mothers are looking forward now on raising their babies, because most of the babies now come out negative, HIV negative. So even the HIV positive mother, you know, it has worked both ways, because now the defaulter rate now this side has decreased, because the mother now is saying, I want to help this child, I want to help this child grow up, I want to see her when she is old, because God has been so good to me, my child is negative, so I have to see her growing up. So it has helped us both ways. The defaulter rate this side has decreased drastically.